Hi everyone! I am making this video to help students who are considering dentistry or orthodontics as a career. So I will give you some insider information about what it will take to become a dentist, what you will be doing on a daily basis, some examples of that, and also what are the different specialties within dentistry as well as the pros and cons within this profession. I'm Dr. Lana Dalba and I am an orthodontist. Orthodontics is that specialty within dentistry where we use braces to align people's teeth. So we would transform the patient's teeth from crooked, malaligned, using braces to make them beautifully aligned and to give people a beautiful smile. This is something I really enjoy within my profession. I really enjoy transforming people's smile and giving them beautiful smiles that they are confident at and that make them very cheerful and happy. How do I become an orthodontist? In order to become an orthodontist, first you need to study general dentistry. In order to study general dentistry, it will depend on wherever you are in the world. If you are probably in Middle East, India or Europe, you would just finish high school and go directly into dental school. Usually around 5 years program, you are finished and you are a dentist. In the US though, and I'm not sure about Canada, probably Canada as well, you would go after high school into a bachelor degree of some kind, and then after that you would apply into dental school. This will make the journey into dentistry a bit longer. For me, I studied in University of Jordan and I graduated in 2002, and this is a very old picture of me with a patient that I just delivered a denture for her actually at the time. Probably this was 2001 or so. So as a general dentist, we are trained to do a lot of procedures, but you can elect to specialize after you finish general dentistry in one field based on your preference and interest. So as dentists, as we know, we remove decay of the teeth and we remove the caries and fill the teeth with filling material. We are also trained to do root canal, and if you like to specialize in this subspecialty, you study endodontics and you become an endodontist where you do more advanced cases of root canal. We also take care of the gum and gum disease, and we remove the calculus and so on. And if you like to specialize in that field per se, you become a periodontist. You would also handle ulcers and oral lesions, and if you like that specialty, you would go into oral pathology or oral medicine. You would be doing extractions, some simple extractions and wisdom teeth extraction. But if you would like to specialize in that field and do more complicated surgeries inside the mouth, you would study more of oral surgery. You can also take courses in implantology, and where you replace missing teeth with an implant, so you become an implantologist. You also are trained to treat children, but that depends on your preference, whether you like to treat children or not. But in general dentistry training, you are trained to handle children. Now, if you like that field and you want to specialize in it, you would take more training in what we call pedodontics, where you will learn more about how to handle children, difficult children, children with special needs, how to do general anesthesia for them, and so on. As you know, as dentists, we also do a lot of veneers and aesthetic work using veneers and crowns, and Hollywood smile now is becoming a trend. So all these you will also learn, and if you like to specialize in that field in more depth, you can study prosthodontics or restorative. In general, having skills of photography is something very good if you want to consider dentistry, because we need to document our cases and showcase our work. So usually having skills in photography is a plus. You would also need to have good skills in the lab and be very patient and be detailed. Dentistry is all about details. It's like the micron of the micron. So if you are someone who likes details, you would really enjoy it. If you are someone who doesn't like details, you would not enjoy that part because it's very delicate and very small area. If you only want to do actually lab work, maybe you can consider being a dental technician, where you don't deal with the patient, you only deal with the cast and the teeth in the lab. So in general, to become a dentist, you need to be a doctor, meaning have that medical part, medical education. You also need to think about some engineering, and your brain need to be engineer because you need to balance things and have the mechanics of tooth movement and other things, as well as have that artistic look and hand to it. So it's really a combination of three things in one. Unlike medicine, where you are only focusing about medicine and not a lot of art, here there is a lot of art to dentistry. So if you like to combine that, dentistry is a very good place for you. In which area did I specialize? Let me tell you, for me, I didn't really want to study dentistry. My GPA, though, didn't get me into medical school. So the second and closest thing to it was dentistry. So I studied dentistry, I was very good at it, I graduated as second in my class, but honestly I didn't really enjoy all what I told you about, from fillings and root canal and dentures and so on. So I looked into orthodontics, because in ortho, not only that we look at teeth, but we also evaluate the face, and we evaluate the smile, and we look at aesthetics as a kind of zoom out, not so much details inside. So that was better for me to get me out of the so much details in dentistry. I pursued my orthodontic training in University of the Pacific in San Francisco, and this is where I did my master's degree in orthodontics in 2007. And then later, actually very recently, I did my second master's in orofacial pain and oral medicine because I like to help people with pain and TMJ pain and headache and so on, and I'm really enjoying that part as well. Usually people ask me, what do I love most about my profession? I would say I really love the interaction with people. I love to deal with children and see how they grow. As you know, orthodontics is a long procedure, so we usually stay together for 1 to 2 years or sometimes even more. And I love seeing children growing in front of my eyes. I love to be interactive with them and build relationship with them. And also, of course, giving them beautiful smiles. The other part I really enjoy is I'm also involved in orthodontic surgery, where we do jaw surgery for the patient. Now, I'm not a surgeon, so I don't do the surgery part, but I am involved in preparing the case with the team to have people do their jaw surgery. So I prepare the teeth with the braces, and then the surgeon would do the surgery. And it's very rewarding to see the transformation that happens in people's life and confidence and smile and aesthetic and even function, meaning speaking and eating and everything really transforms when we do these procedures for the patients. And as I said, my second specialty within the past few years, I have been dealing a lot with headache and TMJ patients. So that kind of took me a little bit closer to the medicine. I feel more of, helping people with pain more than just giving aesthetic results. And that is balancing what I really like to do. What are the challenges in dentistry that you might encounter during the dentistry? Of course, studying dentistry is very challenging. You have to combine the medicine and the dental, so you have to learn so many things during dental school. So that can be stressful for some students. Mainly that there is a lot of clinic and lab work that you have to finish after hours. So many times during dental school, our life become kind of overwhelmed by dentistry. That's something you need to be prepared for, I would say. Another thing you need to be comfortable with is looking at people's mouth, which is not something we are used to. And people's mouth come in different, shapes. So some of them can have bad oral hygiene, some of them have bad smell. So you need to get used to that and to be okay with it. If you are someone who is disgusted easily or have a gag reflex, maybe that's not a good thing for you to consider as a profession. After graduation, if you want to consider specialization, it's becoming very competitive to be accepted in a postgrad programs because there are just too many of us. So that is also another thing that can be challenging. A major challenge is when you move countries. Whenever you move from one country to the other, your license or your degree is not doesn't give you immediate access to practice. You need to go through dental licensing. They need to look at your credentials, and many countries doesn't accept you in the market as a dentist immediately. You have to take exams, or even in the US you have to repeat 2 years of dental school. So it can be frustrating, mainly in an area that we are traveling a lot and moving a lot. As I said, the market is becoming very competitive. There are just too many dentists. Universities are graduating in the past few years too many dentists, so the market is saturated, and this leads to low salaries for fresh grad. Until they become more experienced and more well paid, it takes so much time. Speaking of time and money, studying dentistry is very expensive, whether it is the tuition of the university in undergrad but mainly in postgrad, and also the materials, all the materials and the equipments that we need, whether during school or even when we want to set up our clinic. So the return of investment can be not the best. It takes time to return the money. Another major issue is neck and back pain. As you know, our posture is not the best. We need to access a very small area, and that can compromise our posture, and many dentists would suffer from neck pain and back pain if they are not careful about their posture and they don't exercise properly to strengthen their upper body. People are afraid from dentists, and many people will just say it in your face, we don't like dentists. This means we have to learn how to communicate properly to people. We need to handle different emotions in people, whether it's fear, anger, anxiety, some psychological issues that people can come with. So it can be a little difficult here with patient management. And finally, infection hazard. As you know, we deal with saliva and blood, and that can carry a lot of hazard to our health in contamination with viruses and bacteria and so on. So usually the question is, what else can I work with if I got a dental degree? If you get a dental degree, you really have to work as a dentist. That's the only way out, unless you like to teach, like me. I found myself after I graduated from my ortho program as a faculty in orthodontics, and I really enjoy that part. Most of my time I am teaching. I am teaching dentists who are doing their postgraduate in orthodontics. So that is something else you can do with your degree. But there isn't a lot more that you can do with a dental degree other than this. Being a dentist, you need to really work with your hand. Unless you open a clinic and you manage it, that's another thing you can do. But as a dentist, you really have to work with your hand, and unless you like teaching, then you can also teach. So my final advice to you is, if you are passionate about dentistry, then definitely go ahead for it. If you are half-half, I would suggest you shadow your dentists. If you have a family dentist, ask them if they would allow you to shadow them in the clinic, so that you can get a feel what it will feel like to be in a dental clinic. And if you don't like it, then definitely don't allow anyone to push you into it, because it will be just a waste of your time, money, and happiness. You will not be happy in it. So don't go for it. And if you think you want to pursue dentistry to become rich, then I would advise you there are many, many other ways to be rich other than dentistry. As I said, it's very expensive and the return of investment is very slow, so probably not the best in money-wise. You can make good money, but it will not make you rich as you imagine. And with that, I would like to conclude, and I wish you best of luck in your career and in your life.